Entrepreneurs and professionals from across sectors have launched a collective called Startups versus COVID-19. What started as an initiative by 4 or 5 founders of technology startups is, as of now, a robust collective of over 1,200 people. This initiative has kicked off a wide range of projects in the space in just a matter of couple of weeks. To talk more about the large projects the group has facilitated, joining me today are Critical Care ICU in a Box represented by Anand Dureja and ProjectStepOne, a telemedicine helpline represented by Raghavendra Prasad. Gentlemen, thank you so much for speaking to us. And I have to mention the drone man represented by Aditya Kothari as well, who's joining us in this segment. Thank you so much for speaking to us on Startup Street. Let me start with you, Anand. Take us through your innovations. How do they help fight the pandemic? As I said, we will do this a typical elevator pitch style. So, Anand, let's start with you.
Absolutely. Good evening. So as the number of cases of COVID-19, specifically around a few hotspots, is increasing, the need for patients requiring hospitalization and critical care is fast increasing the available system capacity. So our solution proposes, and what we're trying to offer is rapidly deployable ICU bed and ventilator capacity, which can be put up wherever and whenever required. Essentially, we're bringing together 3 critical components: the space required to put together this facility, the equipment, which includes not just the ventilators, which have often been talked about a lot in the last few weeks, but also other ICU equipment, and the personnel, which includes not just doctors, but nurses, assistants, sanitation and hygiene staff, to get things up and running. And what our basic premise is putting these things together in a very short amount of time, being prepared that whenever in any city that the situation calls for it, we can bring these together and put up ICU capacity. So this is what we are working on, and this is...
Sorry, I'll just, since we're short on time and we had to keep this elevator pitch style, I'm going to quickly request the drone man, Aditya, to jump in right here. Tell us, what's your initiative and project all about?
So what we're doing is we're essentially just making a single platform for all the drone pilots and drone owners to come across, and connecting them to the government and police officials for various purposes. One is for surveillance, second is for monitoring, third is for announcements. So that's essentially what we're doing. We have 50,000 plus drone pilots in India. So as of now, we've got 600 plus registrations on our platform, and we're live in Mysore, working with the Mysore Commissioner, parts of Bangalore and parts of Mangalore as well.
Okay. Raghavendra, tell us ProjectStepOne, what's that all about?
Yeah, thanks, Megha. Thanks for having us. ProjectStepOne is we are providing an easy way for citizens to reach doctors via telephone lines, the government telephone lines. So a large number of people are suffering from COVID symptoms, as well as have other reasons to reach to doctors, and most hospitals and OPDs are not available. And these people are calling the government helplines, which are getting choked. So we are providing both scalable technology as well as a scalable network of doctors, which the citizens can reach by a simple call to a toll-free number. We're already live in 7 states: Karnataka, Odisha, Chhattisgarh, Punjab, Madhya Pradesh, Maharashtra, Nagaland, and we are going live soon in Uttarakhand and Meghalaya. So we have basically providing a very simple way for people to reach to doctors, especially those who are with COVID symptoms, so that they don't have to talk, they don't have to step out of their house or go to a hospital directly, and thereby we are preventing the spread.
Okay. All right, Aditya, let me come back to you. Your project Drone Man primarily helps in surveillance, as you just explained to our viewers. Currently, I believe you're live in 2 cities. Take us through the other offerings. Tell us how you're augmenting ventilator capacity through your ventilators and ICU infrastructure support group.
So I think you got it wrong. So we completely, we're just working on the drone part of things. So the ventilator and the ICU, what we're actually trying to do is we're trying to talk to hospitals and seeing if our drones could supply them the basic essentials like the PPEs and masks in hospitals. Because as you know, that people are really scared to enter the hospitals right now. and drone would be the best solution to deliver these things.
Okay. Anand, tell us how critical care is helping fight the pandemic right now. I believe you have a pilot project running at St. John's Hospital in Bengaluru. But tell us essentially what's happening on ground and how are you facilitating that?
So just a small correction, we still don't have the pilot running. It will be up and running. We are just making preparations.
Okay.
Essentially, the biggest pieces and the pieces which have been hardest to crack have been around equipment. So getting ventilators, a large part of the supply chain which has been from China. So working with very strong logistic players who've managed to connect with these suppliers to our manufacturers, helping them manufacture domestically, as well as working with a lot of other 3D printing companies and small manufacturing facilities to augment capacity. The other key piece has been getting personnel up and running for this, for setting up this pilot project. And a lot of startups have helped in this part. So for nurses, for example, Portia has been very helpful in bringing nurses. For sanitation and hygiene staff, Urban Company has brought in their personnel where required. So making sure that all the pieces can come together for putting up ICU facility has been one of the biggest challenges, where we've got a lot of support from the startup ecosystem.
Okay. Could you help us with the timeline of your pilot project? Since you said that it's not up and running yet, but do you have a timeline set for that?
That has been one of our biggest challenges. This is a philanthropic endeavor, not an investment. So we're still looking for more. I think the first 5-bedded pilot, and the total cost comes to around 10 lakh rupees per bed. We should have up and running in the next few weeks.
All right. Okay, next few weeks. That's the timeline that you're looking at right now. Raghavendra, a large number of angel investors and founders have come together to support these projects. And, as this is coming up again and again, that financials and finances are one of the big drivers to kind of action these initiatives and turn them into real-world projects. So talk to us about what role have they played so far to push forth the cause? How has the ecosystem come together?
Yeah, I think one of the key things for a telemedicine network is doctors. And luckily, we have around 6,000 doctors who have come volunteer to actually practice and consult for free on our network. And that has been one of our biggest strengths. And, the biggest cost for any medical facility will be the doctors. And they have come forward in large numbers to practice and consult for free. The second aspect is, we have a lot of costs with respect to telephony and things like that. So ProjectStepOne has been lucky to find investors. The ACT fund, which is a coalition of several founders and venture capital companies, have funded us. So has the Omidyar network. And we have other institutions who have come forward to help us and have been extremely forthcoming in terms of funding this initiative, because we're already live in a few states. We went ahead live, hoping that these funds will come, and they are coming through.
Okay. Aditya, could you help us understand where does this go from here? How do you plan to scale your project on a national level?
So yeah, we're talking to certain state and central government to scale this up. We're also trying to talk to a lot of drone manufacturers in India, if we could work with them along the same lines and integrate multiple features to scale this up across India. So this is what we're currently doing right now.
Okay, Anand, quickly, you want to take up that as well, your plans to scale this project up? What would you need?
Absolutely. For us, success means being able to deliver on our pilot and being ready to set up capacity. We want that in eventuality, there should not be a situation that we need to put up so much of capacity, but being ready and working with state governments, showing this proof of concept would be success for us.
Okay. Thank you so much, gentlemen, for sharing your ideas and your projects with us. And of course, for viewers tuning in and who are inquisitive to know more about their projects, you can look it up online as well. And there was a link flashing on your screen to make donations and do your bit to support these projects turn into reality. With that, it's a wrap on this edition of Startup Street. More news and updates coming up for you on the other side. Stay tuned.